in New South Wales. So to 8 p.m. last night, we had 105,963 tests. And I want to thank the community again, particularly in southwestern Sydney and western Sydney, for coming out in great numbers. We really do need you to continue to come out to be tested, because if we don't have a clear line of sight on what's happening, that's very, very hard to respond to it. Of those tests, we had 210 cases locally acquired. There were 2 overseas acquired. Again, unfortunately, of those 210 cases, by far the majority were in southwest Sydney and western Sydney. We had 81 cases acquired in southwestern Sydney and 72 cases acquired in western Sydney. Again, the focus, unfortunately, has been in that area, and I would just ask everybody in that local area to do what New South Wales Health has asked now on many occasions, and that is stay at home. Just stay at home. Unless you must go out, unless it's essential that you go out, stay at home. And definitely do not go and visit another household. I know that you want to go and visit your aunts, your uncles and cousins, we all do. But unfortunately that is, it's continuing to be a very dangerous exercise, and the virus is continuing to spread in that southwestern Sydney and western Sydney area. I also want to emphasise along the way, particularly in the earlier stages of this epidemic, there was a real focus that the virus in its previous forms was particularly focused on older people. Can I say the Delta variant is partial to younger people as well. It definitely is circulating in the younger community. And I want to stress that of the 210 locally acquired cases, two-thirds, 138 cases, were people under the age of 40 years old. So my message to younger people is, please understand this is a virus that you can be susceptible to, and you can end up being one of our positive cases. You can also end up in hospital, and you can also end up transferring the virus, sadly, to some of your relatives, and those relatives may well end up, as you may, in hospital, and of course may pass away. The continuing numbers are impacting on our hospital system. I want to emphasise that, and I want to thank the nurses, the doctors, the cleaners, people who are putting themselves at the front line day after day to care for people who are becoming positive with COVID and needing hospitalisation. Currently we have 198 people in hospital in New South Wales. 53 of those are in intensive care, and 27 are requiring ventilation. That tells us that it's an extremely serious disease, and people are ending up in our hospitals in substantial numbers. And of course that's a concern not only for those individuals, but also obviously for the health staff who are caring for them and putting themselves on the front line. So I would just say to people, please listen to the message, please isolate, please stay at home, and understand it doesn't just impact on you and your family, it also impacts on health workers, it impacts on our police, it impacts on all of the police who are, all the people who are necessary to support you when things aren't going as well as we would like with this Delta virus. Again, stressing to young people the dangers. In intensive care at the moment, I think a lot of young people would be surprised to know that there are 6 people in their 20s in intensive care, there are 4 people in their 30s, and there's 1 person in their 40s. So just at the moment we have 11 people in intensive care who are all 40 years old or under. That is extremely concerning. We have another nearly 39 cases also in other parts of the intensive care system. And I want to stress we've got 18 cases in their 50s, 14 cases in their 60s, 9 in their 70s and 1 in their 80s. So the older age brackets are actually having less numbers now. It's the younger people who are actually taking up places in our intensive care units in our hospitals. Can I stress the need to the businesses? Generally, the businesses across the 8 local government areas have been very responsive to trying to conduct their essential businesses and to make sure they're providing food for the community and distribution of products more broadly for the community. But what we are seeing is quite a number of cases arising in those smaller businesses. It's an interesting fact that some of the bigger distribution centres, for example, are actually managing, even if they do happen to get a case in their larger distribution centres, they're managing them well. And we're not seeing outbreaks in larger centres. So the major retailers, particularly our major grocery retailers, are managing the situation very well. But we're seeing problems in the smaller shops, smaller food shops, and the smaller distribution areas. Just as an example, there was a pizza shop in Belmore where one person came in positive and 8 staff ended up positive. That's a huge problem for the community, but it's a huge problem for the business proprietors. So I would just say to you, if you're running a small business providing the essential items that the community needs, then you need to understand that your business may be shut down, but you may see all of your staff put at risk and in fact become positive if you don't have a very good COVID-safe plan. So please understand that that's an absolute necessity. And of course, as Dr. Chance and Dr. McAnulty have said many times, try and make sure that when people come to your shop as well, when people come to buy a pizza, for example, don't have them all standing at the counter. Have very clear signs that they should be waiting outside and keeping socially distanced until their pizza's ready. Also want to stress that on the logistics side, we had one particular freight organisation where 24 workers have become positive. Now, again, that's a similar situation. We need to make sure that in these smaller logistical organisations, the owners understand the need for a strong COVID-safe plan in the first instance, but then applying the COVID-safe plan. It's all very well to have a plan, but if you're not applying it, then you're going to see your business effectively shut. And that's not good for you, but it's also not good for our community, and it's also not good for your workers if they all become positive. I'm going to ask Dr. McAnulty to just address this in terms of some of the other issues related to the public health messages, and then I'll ask the Deputy Commissioner to talk about some of the issues for policing more broadly. So, Dr. McAnulty.
Thanks very much, Minister, and good morning. So I'll just give an overview of the numbers from yesterday until 8 o'clock last night. There were 212 cases of COVID reported in New South Wales. Of these, 210 were locally acquired and 2 are acquired overseas. 88 locally acquired cases were linked to a known other case or part of the cluster, and 122 remain under investigation. There have been now 3,190 locally acquired cases since the 16th of June 2021 when the outbreak began. There were 105,963 tests reported to 8 o'clock last night, which is up on the previous day's total of 95,446. By isolation status, of the 210 locally acquired cases, 58 were in isolation throughout their infectious period and 11 were in isolation for part of their infectious period. 21 were infectious in the community, and we're still investigating the status of the others. Of the 53 patients in ICU, 6 are in their 20s, 4 are in their 30s, 1 is in their 40s, 18 in their 50s, 14 are in their 60s, 9 are in their 70s, and 1 is in their 80s. Of the 53 people in ICU, 1 person has just received their first dose of Pfizer, and 4 have received their first dose of AstraZeneca. We sadly report a death that was reported yesterday but confirmed overnight in a person who had COVID. This is a man in his 60s who was confirmed overnight. He was a resident of southwestern Sydney and passed away at home. This is the 70th death, sadly, in New South Wales related to COVID-19, and the 14th in the current outbreak will be included in tomorrow's official numbers. We extend our sympathy to family and friends of this person. Thank you.
Good morning, Minister. Good morning, ladies and gentlemen. I'd like to begin by sending one final message to anyone who is intending to go into the city to engage in protest activity. Do not do it. Our policing operation has been in place since early this morning. Up to 1,000 police officers, including a range of specialist resources, are on the ground already, so do not go into the city to protest. Strikeforce seasoned investigators have been continuing their investigations into the events of last week's protest. 85 people have been charged to this date. Over 300 infringement notices have been issued. And just last night, a 49-year-old man from the Central Coast was charged with criminal offences relating to the incitement of last week's protest online. In terms of the wider compliance operation, in the last 24 hours, 384 infringements have been issued, 41 persons have been charged with offences relating to breaches of the public health orders. Police have responded to almost 1,500 COVID-related jobs. 885 of those were Crime Stoppers calls. Our compliance operation will be ongoing. We've spoken over the last few days about it being ramped up considerably, but it's also important to note that existing emergency management arrangements are in place at a local, regional and state level. That includes our multicultural liaison officers, staff from Multicultural New South Wales, the Department of Customer Service and other agencies reaching out and providing support to people in the 8 local government areas of concern. Thank you.
Yeah. I'm sorry, say that again. Yeah. It's an interesting issue, because what we're seeing, 5 or 6 weeks ago, before we had this current outbreak of the Delta variant, I think there was a level of disinterest in Sydney in getting vaccinated, largely because in New South Wales people have been really good and it's been managed very well since the original variant of COVID came. But what we've seen is a real uptick in willingness to have one of the vaccines, either one of the vaccines, and I think particularly the opening up of the pharmacies has seen a rapid uptake in the 20 in the regions and the 50 in the city. We wrote, or I should say the Health Secretary wrote to Brendan Murphy, I think it was the second week of July, and asked for approval to allow all pharmacies in New South Wales, there's about 1,250 of them, to be able to provide the AstraZeneca, and indicated that the AstraZeneca could be used for that purpose because it would take it out to the front line, if you like. And what we're seeing is a real uptick. So you'd have to say that if people actually continue to continue the growth of the interest in having the AstraZeneca or the Pfizer, whichever's appropriate for them, it could well be perhaps. It's hard to put a precise time on it, but certainly later this year, but perhaps in another 4 months or so, we might see getting into that position where we might have the figures that are being talked about by the federal government. But it really does depend, I have to say, on the community coming forward and putting their arm out for a jab. So I just say to everybody, please come forward and have your jab, because it is the only way forward. It's disappointing to me, I think disappointing to everybody who's had the jab, that others might hold back our freedom. So my strong message is go and get vaccinated. Sorry, Liz. Oh, Lizzie. Hello. Right.
Is that 70% in line with New South Wales government modelling? Is that what you guys agreed on as well?
The figures that we were talking about with our public health units were 80%. But obviously the National Cabinet can agree on a national-wide figure. And I think that, obviously I don't go to National Cabinet, it's a matter for the Premier, but the National Cabinet's made an arrangement, an agreement across the country, and I think it's important that there be a uniform position. It doesn't help having different governments doing different things. It's never helped us, actually. I think it's been one of the things that has put people off the fact that one state will close at the drop of a hat and do something differently. So I think it's a positive that there's been an agreement.
Just on those closures...
Sorry, can I do Jess first?
Sure.
Would you be able to give us an update on the investigation into 4 New South Wales health staff that may have attended the protest last weekend?
Sure. Yeah, look, can I just say how disappointed I was as the New South Wales Health Minister to hear that there had been, first of all, the protest itself, but secondly, the fact that 4 health staff would think it was appropriate to go to such a demonstration. Investigations are currently continuing with both health and the police. I understand there was 1 paramedic and I think 2 either assistants in nursing or nursing staff and 1 other that I'm just not sure about at this stage. But the investigations are continuing. Obviously, it's a fine line, isn't it? People, democracy are entitled to demonstrate legally, but of course it wasn't a legal demonstration. It was absolutely not approved by the police. And so it has consequences both under the public health orders and potentially under the Crimes Act. The police are continuing their investigation as well.
Minister, have you got any information to suggest that anyone with COVID actually attended those marches?
What we know, and we said this yesterday, was that 1 gentleman was stopped by the police who did an amazing job last week under terrible circumstances. But 1 gentleman was stopped at the central station and turned around. He was given a $1,000 infringement, and he, it appears, did actually comply with the police order, and I thank him for that. I thank those who saw that they were doing the wrong thing and followed police instructions. And as far as I'm aware at this point, unfortunately he did test positive, but we believe he did not actually go to the demonstration. So at this point the investigations are continuing. Look, can I say one of the challenges here is that the police have their job, which is to obviously identify the individuals who attended and to take action either under the public health orders or under the Crimes Act. And clearly some of the actions we saw were very much under the Crimes Act domain. I mean, throwing missiles at police officers is absolutely appalling, and their horses, atrocious. So I'm quite sure the police investigation will continue and they will lay more charges. In fact, I might ask the Deputy Commissioner who'd like to make some comments about that. Can I also say that, just finishing what I was saying before I do that, that the health side of things, though, what we want is people who may not have been subject to any of those actions, but may have been as well. If the police, whatever action the police take, our health action is separate and apart, and that is we want you to come forward and be tested. We don't want to run the risk that you've spread that virus amongst other people who were at the demonstration, the illegal demonstration. I'll just ask the Deputy
just quickly on that point.
I'll come back. Deputy Commissioner.
Thank you, Minister. As I said, Strike Force seasoned investigators are continuing their investigations into last week's protest. 85 people have been charged to this point. We know of hundreds of others. The investigations will continue until we identify people and take action, whether it be criminally or whether it be under the Public Health Act for their actions, and that's ongoing. So there is a team of detectives who have been investigating matters ever since the protest occurred, and as I indicated, that person was charged last night from the Central Coast with using social media to incite the process itself. So those investigations will be ongoing.
The ring of steel around the CBD is in place, but what's the feeling about whether you might see protests in other parts of Sydney today?
Look, as the Commissioner said yesterday, we'll have up to 1,000 police officers on the street. You've seen, as we speak at the moment, there's a significant traffic operation underway. There are resources that are in the city, but those resources are mobile. They can be deployed anywhere across Greater Sydney and indeed to the outskirts of Sydney as well, should they be required.
What sort of fines could people face if they breach the, getting into taxis or ride shares or operating taxis?
Well, the existing public health order fines, including infringements up to $1,000, and as the Minister just said, you engage in illegal activity, you may well be charged with criminal offences as well.
Deputy Commissioner, what sort of a scale is this police operation today? What is it in comparison to, and the roadblocks and all of that thing?
Look, we don't apologise for today's operation. We've made it very, very clear that people should not go into the city and engage in activity like we saw last week. So in terms of the scale of it, it's a large operation, but we're well versed at doing that. We've been doing that for some time. Also, it's important to remember that police have been engaging in delivering operations for the past 18 months under COVID conditions as well. So it's significant. And if we don't see scenes that we saw last week, that's a great outcome for us. And those resources can be used elsewhere.
Minister, you mentioned before the importance of reaching that 70-80% threshold when it comes to reducing
Sorry, I just missed the first part.
You mentioned before the importance of reaching the 70 or 80% threshold when it comes to lockdowns, border closures and the like. The WA Premier has reserved the right to use lockdowns after that 70 or 80%. What kind of message does that send to people about getting vaccinated? What kind of incentive is that?
The WA Premier's always had his own way of dealing with things. I think the important message to the community is that if we all get on board and get vaccinated, our life will go back to being much more like it was before. Obviously, the Delta variant has turned our lives upside down, and we're all desperate to get back to some degree of normalcy. So my message to the community more broadly is we will get closer to normalcy if we all get vaccinated. And I don't want to comment any more than that on the WA Premier.
Minister, there are 122 cases under investigation as of today. Does that show that the contact tracers are really struggling at the moment?
When you have a number of successive days of intense numbers, particularly in communities where it's sometimes very hard to get simpler answers, it can take a while. I met last week actually with the senior people amongst the tracer team and the case interviewers. What they were indicating was that translation is an issue for us. We need to have translators, and we do have them, of course. And we have the need in some cases to revisit on multiple occasions, and one interview with one person can take over a period of time up to 8 hours. It's quite substantial. Having said that, we have help assistance in the tracing team, as we've had. I mean, I remember when Victoria was having challenges, we offered them assistance, and we've offered other states assistance, and they've been really good. The other states have offered us assistance. Also, the federal government has offered assistance through the ADF. Last time, I think it was in March or April last year, I walked into the 5th floor of the health building and found probably about 100 ADF, Air Force, Navy, Army staff who were helping our tracing team, and they're very good at it, very, very good at it. And I've spoken just in the last couple of days personally to the Naval Rear Admiral in charge, and just said to him that if they could make available some of those team that worked before, or even others who have public health capacity, that would be really good, just to help our teams. But yeah, it's quite stressful for all our tracers and contact workers. They're working through that and trying to do it as urgently as possible.
Minister, just a question on public health orders. So we're hearing from the Strata Community Association and the Owners Corporation Network that cleaners are leaving the hotspot LGAs and going into other parts of Sydney to clean apartment buildings, take the bins out, that sort of thing. Can you clarify, under the public health orders, is that allowed for cleaners to leave those 8 hotspots and clean apartment buildings in other parts of Sydney?
No, absolutely not. And they shouldn't be. And actually, can I say, I think it's incumbent upon, I mean, it may be genuine confusion because public health orders are developed and then put out very quickly in response to changing circumstances. And so there'll always be a level of some people not understanding immediately. But I think the issue there is, for example, if I had somebody coming to do any work at my place, I'd be just asking them, are you from the LGAs that are currently of concern? And I would be taking responsibility myself. So by the sound of it, the strata body organisers have asked the right questions, and they just need to tell those people that please don't come.
Minister, some of the organisers of the protest have websites urging people not to get tested. Are you worried that people who attended the protest last weekend aren't going to get a test?
Yes, and can I say I am concerned about that, and I think that quite simply, those people who went to the demonstration should get tested. They should. And can I assure them that the health team is there just to get the health results. If the police come knocking on your door for other reasons, that's a matter for the police to do, and I'm totally supportive of the police doing that as well. But if they just come forward and have a health test, then that's not actually something that goes to the police. The police do their own investigations. It's exactly the same as going to your own doctor. You will be treated confidentially. I may not like the fact that you were there as Health Minister, but I can assure you that you still get the same courtesy and privacy if you go and have a health test, and we would like you to have a health test, because the bigger issue for us is to make sure our community is as safe as possible.
Minister, will we ever really...
They won't stop, though, the police coming and knocking separately once they've done their investigations. Entirely separate matter.
Will we ever really know the full scope of how many cases did arise from that protest? I mean, it would be very easy to just go get a test, you're positive, and just lie. Will we ever know what the full impact was?
You're right, Jess. That's just the reality of a COVID pandemic. If people don't want to tell us the truth, then... But what happens is, once you're a positive case, we have expert case interviewers who would talk to those individuals. Obviously, they would be put into isolation, and if they're sick, we would look after them in our hospital. But the case interviewers would go through very clearly and get them to understand that by not telling our health workers the truth, they're putting their family and their friends at risk. So, from what I understand, more often than not, people are telling the truth. But I do think there's a whole set of circumstances where people, not just at that protest, but in other circumstances, don't necessarily tell the whole truth. And I would just say to them, as we've said on a number of occasions, please tell us the whole truth, because from the health point of view, we just need to know who you've been with, where you've been, so we can try and track and trace this virus that is using you as a method of getting to others and making them ill and possibly going to kill them.
Just things like pop-up vaccination clinics at churches or big employers doing vaccinations. How important is that to going forward?
I'm sorry, what was the last?
How important is that in terms of getting vaccinations done?
One of the challenges, particularly in southwestern Sydney and western Sydney, we have found, as by the way they did in northwestern suburbs of Victoria, is that a lot of the community are, they really do need us to come to them. They need health to come to them. They come from very disempowered circumstances overseas. They're often refugee populations. They may not have been treated at all well by their own governments. And in some cases, there's a fear of coming to government or coming to anybody, even hospitals or health facilities. And so whilst our focus has been on trying to get the mass vaccinations done, our health staff on the ground in Sydney Local Health District, Southwestern Sydney Local Health District and Western Sydney has moved into a, if you like, a micro phase where they're now trying to reach out at a micro level to various subsets of the community. And I want to thank the health staff who've been out doing that. They've been to mosques, they've been to Sikh temples, they've been a whole range of different ways that they're now reaching out. And can I say thank you to the community? I think if you don't speak English and possibly don't read in your own language, it's very hard for our health staff to reach out. But if we can go to them and go to the community leaders, such as the temples, the mosques, the churches, then their community leaders can give them the assurance in their own language that our health staff are there to help. And it seems to be working very well at the moment. But can I say it's obviously a slower process. We might get through only a couple of hundred at a temple or a mosque or a church or possibly other venues, whereas at Homebush we can get through at the Olympic facilities. Sorry, 2 seconds. We can get through about 9,000 a day. So but we're trying. Yeah,
Minister, construction is back. However, a lot of the workforce comes from the west and the southwest. Is there anything companies can do in this circumstance, given that they might not have any workers on the tools?
Look, it is challenging. I know I've had health advised me that the health ministry has been approached by a number of companies who are telling us that they have very substantial numbers of their workforce in the southwestern and western part of Sydney, and that would be expected, and very good people who do the jobs. But right now the focus has to be to stop this virus, and so the priority here is to stop it. Stop Delta. If we all get vaccinated and manage to stop the virus, then we can all get back to work a lot quicker, and that has to be the focus. Nothing's easy in a pandemic, and this is one of the really difficult decisions the government's had to make. But again, I talked to the other ministers around the country, the other Liberal and Labor health ministers, and in other jurisdictions, such as particularly in Victoria, they've had the same challenges, and they've done similar things to what we've done, and we'll continue to do it. But I'd love to just have people. I'd love to be standing here in a couple of weeks and say that people have actually, one, come out and got vaccinated in great numbers, and two, stayed in their home and not gone and visited relatives, and shared the virus, and then we'd all be in a much better place.
The rapid antigen testing for HSC students, has New South Wales Health procured those tests? If so, how many? And secondly, how are they going to be administered? Are they going to be self-administered?
Look, education and health are working through those issues. There are different models that have been used around the world, and accessing the numbers of rapid antigen testing would appear not to be a problem. The issue is how they'll actually be administered in what circumstances, and that's still being sorted through with education. So I can't give you a definite answer. I would think early next week they'll have a better idea, because they're still working on it over the weekend, as well as I understand.
Well, what information do you have about this man who sadly died in southwest Sydney? How did he acquire that?
Look, we talked briefly about that particular gentleman yesterday, but what we are seeing, and it's a terrible situation, is that families, for a variety of reasons, particularly in the southwest, are not coming forward when one of their number is ill. And of course, what we know about Delta is if there's one person in a household and you have another perhaps 6 or maybe even 10, in some cases more people in a household, all of them are likely to get the virus. Why is that happening? There's a variety of reasons. One postulate that was put to me yesterday by people on the ground there was that people are worried about their income, and if there's one person in the household who's the main income earner, they don't want to come forward. They don't want to tell anybody that they've actually got the virus in the household, and that's very problematic. And I think that's why our state government and our Premier and our Treasurer have worked so hard. I mean, you would have heard the Treasurer talking to the federal government about reinstatement of JobKeeper. Well, that didn't happen, but I know the federal government and the state government have agreed on economic arrangements that are now trying to be a lot more accessible to try and deter people from having that concern. But it's not easy, particularly when you're trying to communicate that to communities who perhaps don't speak any English at all in some cases, and have difficulty reading. So it's challenging. It's very challenging. But I can assure the community in southwest Sydney that our state government and our federal government have worked together, and they have got funding available to support you. And certainly, if you need that information, you can go on to the Service New South Wales website, which I think is nsw.gov.au. And certainly, if you have problems, then I would strongly suggest you speak to your local community leaders who might have the capacity to clarify the translations that are available.
Was there a cluster that he was connected to?
I'll ask Dr. McAnulty that. I'm not sure about that. Dr. McAnulty, do you know the answer to that? No, well, I've asked, but he doesn't know. I'm sorry. Can't answer that question.
Do we know, just quickly, if the man knew he was positive? Did he go out for testing and then just didn't reach out for medical care, or was he unaware he even had the virus?
Obviously, this is there's a fine line here in terms of people's privacy, but I understand that the family certainly was suffering symptoms. But you'd expect that in that situation there would be members of the family suffering symptoms, but it's a very, very difficult situation. It's not easy. Yes, Lizzie, sorry.
Minister, you mentioned 24 cases at one freight company.
Yep.
Any more details on that?
I'll ask Dr. McAnulty whether he wants to do that one. Just so I don't break.
So throughout this epidemic, there have been a number of workplaces affected by COVID, and this freight company is one example of that. They're places where people are congregating together, having a lot of interaction between themselves, and that's a place where you get, of course, the opportunity for transmission. And so 24 cases is a lot, and it's an example of just how infectious this virus can be, and why it's so important to have those COVID safety plans in place, because any of businesses across Greater Sydney can be affected. Somebody might turn up without symptoms or with very mild symptoms, and so it's so very important to make sure that you've got those things in place, such as awareness of getting tested, not coming to work if you do have the mildest of symptoms, making sure you've got staff awareness and clear plans about separating, wearing masks throughout the work period, good hygiene. So it's really important that we're all aware that this could strike any business at any time, so be well prepared by having those plans in place.
How concerning is it as a freight company, though, given the movement?
Yeah, so it's concerning when we've got companies who have interactions with deliveries to other businesses, because that's a great way for transmission to occur. And so in these sort of situations, I believe it was in southwest Sydney, in these sort of situations, it's very important that you look after your own business, but also those businesses you might be interacting with.
Is there any reason why you're not saying which company?
I just don't have it in my head at the moment, but we can get back
Dr.
to it.
McNulty, can I just quickly ask about the Aldi at Balcombe Hills? An infected staff member was there on the 21st and 22nd. It was closed, deep cleaned, reopened yesterday, but only went on the alert list this morning. Is there any reason why there was a delay in that?
I don't have the specific details. We'll have to get back to you about that one. I'm sorry.
Were those workers at the freight company subject to that 3-day testing? Is that how it's been picked up, or is it somewhere else?
I don't have my understanding is that we have found a number of cases, and I can't say specifically whether it's this particular company or not, where the rolling testing has actually identified people who wouldn't have otherwise got tested. So I think that just highlights the importance of making sure that we all check on the website on a regular basis about what the rules are around getting tested and what you can and can't do as an authorised worker, but also that basic message of getting tested if you even have the mildest of symptoms, and following the public health advice if you are an identified contact of a case, and following those testing rules. Testing is the key thing to getting out of this outbreak, along with vaccination, and it's so thrilling to see the over 100,000 cases of tests we've had in recent times. People are getting the message, and we really thank them for it.
There's also this decision yesterday on elective surgery. Are our hospitals coping? Where are the bulk of the COVID patients being treated?
Sorry, COVID patients are being treated at a range of hospitals. And the real issue, I think, is that, as I've said a number of times in these press conferences, that each time there's a positive case that comes in, for example, to an emergency department or an intensive care unit, quite a number of staff have to be taken offline. So just here at Royal North Shore a couple of weeks ago, we had nearly 200 staff taken offline. Fairfield, there were 100 staff. And the message is that with the increasing numbers of people coming into hospital, but also just being managed, if they're in their home, they're still being managed by medical staff, by hospital staff, remotely. It's putting a lot of pressure on the health system. So it would have been in June last year, I think, when we had the previous situation, a decision was taken to ease back on the non-urgent elective surgery. All urgent surgery is, of course, being undertaken. And then there are, when you get into the elective categories, there are 3. It's Category 1, Category 2, Category 3. Category 3 is normally surgery that is not pressing, and can take up to a year, in fact, when we've got lots of numbers waiting to be done, lots of people waiting to be done. It's what health has determined is that this was an operational matter. It wasn't determined by me as the health minister. It was obviously an operational matter by the ministry and the chief executives of the local health districts, the 15 local health districts. In some areas, they have decided that they will ease off on Category 3 and some Category 2. But they're also, what wasn't made clear yesterday, which surprised me a little bit, and I've asked Health to clarify that today, is that the good news is that quite a number of those cases will still be capable of being dealt with through the private hospital system. We worked very well last year with the private health system. That is, the state health system worked very well with the private system. And some of those, particularly the Category 2 cases that might have to be eased back for the time being, quite possibly could be dealt with. Often the surgeons are working in a public health system and a private system. They work in both. So it would be possible to do that. And I think Health will be putting out a clarifying statement a bit later today.
Estimate as to how many New South Wales health staff are currently isolating?
I can't answer that. I don't know.
Is it hundreds? Is it a lot?
Well, at any one time, right now, there would be certainly hundreds in my view, yeah. Yep. Any other questions?
So just on that, the HSC rapid antigen testing, has the state actually procured any as of yet?
That hasn't been presented to me as a problem, so I'm assuming that they have. But can we answer that? Perhaps I'll ask, I think Dr. Chant's here tomorrow, so hopefully we'll ask her to do that one if that's all right.
Can I thank everybody for your thorough questioning, but also your courteous questioning, and I want to thank the Auslan interpreters yet again for doing an amazing job. Thank you again. Thanks very much, everybody. Thank you.